By the way, Doctor Long, how old are you? You look quite young, actually. Exclude the hair, you look actually quite young.
55. 55.
Wow, 55. And you still do you plan to retire or to continue doing this?
Not yet lah, cannot.
Wow, okay lah. I like it. You don't look like a 55, seriously. You're energetic. You're quite energetic. You're quite energetic.
People listening to us again now.
Yeah, it's already live. You can see on the screen, upper left. That's a live word, so it's actually live. I think this is the first live that we do it on using English. This is the first live. That's the English live. Normally we're using Chinese lah. Normally, yeah.
Sorry lah, half banana.
So no, it's okay. It's okay. I think it's good also lah. We can get different crowds to come in, and then we have different things to see. Yeah, and then some they also like to have like to see English live rather than Chinese.
Sure.
So we I think it's a good start lah. Maybe next time we also can have more live based on English. Yeah.
Can we see how many people is online?
Unfortunately, we can't see through here. I think only Edward can see how many people are watching the live now. Okay, 4 people now. So I guess we have to wait slightly longer, slightly more time.
So for the rest of the people, good evening. We'll wait for the rest to come in first.
Yeah, we'll wait the rest for the come in first. Can't wait for the English sharing talk. Hello, sweetheart girls. Okay, very nice name. I'm interested to hear more about the mind-gut connections from Doctor. Okay, I think Dr. Long will share later. Mind-gut connection.
Yep, we can chit-chat later on. But maybe let me go through my simple presentation first.
Yeah, simple presentation from Dr. Long. Very informative. Hopefully you guys can get a lot of things, after the live. And then if you guys have any questions regarding, gut health, you can actually write out the comments and then let us know what question you want to ask. And then if we have if the time is allowed, we will also, let Dr. Long share about the questions. Okay. So please don't hesitate to leave down any questions regarding gut health.
Yeah, free consultation.
Yeah, free consultation.
So
not one-on-one.
Of course, I may not be able to answer everything, but we'll try.
Yeah, we'll try. Okay. So leave any questions that you want to ask. Okay. And Dr. Long will be more than happy to give you the sharing of the answers. So we'll start the sharing shortly. So if you guys can share, you can share the link or the live to your friends and let them come in and watch and see and learn and ask questions. Okay, ask questions. Okay, if you guys can help us to share the link, I will be more than happy to see. Okay, wow, Sweetheart Girl started to ask questions already. Okay, we will come to that part. We'll come to that part on the Q&A session. Okay, but do leave questions. So, Dr. Long, how long have you been doing this gastroenterologist for how long?
About 20 years or so.
20 years of history, 20 years of expertise. Okay, I believe there's a lot of gut health questions, or people may experience undescribable feelings on their gut that they don't know how either they think it's normal or they don't know what is it, and then they just leave it or just let it go. But I think there will be a lot of interesting things to see for tonight about gut health. Yeah, even me personally, I'm also very interested in gut health. I did
it's a very common problem, so nearly everybody will have it. So
and then
probably I'll share with you at the introduction there why everybody will have this.
Yep. And then I also did last time I also did my colonoscopy and from the top and the bottom.
Wow.
It's a very interesting journey.
Okay, now the host wants to share with you his experience.
Yeah. Well, gut health. Okay. I'll share a little bit before we start the whole thing. Okay. I believe there's a lot of people they experience, or they may heard from their friends, families, that for example, I did very busy, and then I sometimes tend to forget to eat, until the extent I have a very I start to feel uncomfortable, and then I go to the clinic, and then the clinic give me some medication, and then this and that. Okay, this is my experience. This is my experience, and then after the clinic, after the medication, I don't feel the pain anymore. But okay, I do feel weird. I don't feel normal. I feel weird in my gut, but although I don't know how to describe. Okay, I do feel weird. So I went to the hospital. I went for the checkup, and then they found out that there are ulcers in my stomach.
Really? Yeah.
Yeah, there's ulcer in my stomach, and then maybe the doctor says it may be because of bacterial infection. So went through all the hustle, this and that. So I think there's a lot of people may experience or may heard similar things. Okay, and wonder why it could happen.
That one is something that I'm going to share afterwards. Yeah.
Yeah. So this is my case study. And hopefully from this case study, and after Dr. Long's sharing, you guys have a clearer picture of how to take care of your gut health. Okay, and if you experience certain things, what's the next step you can do? Okay, so we're going to start our sharing right now. So I believe this is the first time. We do English live sharing. Okay, in our live history. Okay, this is our first English sharing, and together in conjunction with with Life Care, and then we are proudly to invite Dr. Long, okay, Dr. Long Yik Yi, to share to us, okay, share with everybody about keeping the gut healthy. Okay, brief introduction of Dr. Long Yik Yi. Dr. Long is graduated in UKM, BSc UKM, and then MD Hons in UKM, and then MRCP in UK. And Dr. Long is a consultant physician and gastroenterologist, currently in Life Care Diagnostic Medical Center. So please welcome Dr. Long.
Thank you for the kind introduction. So first, thank you to the organizer to invite me to share my passion about gut health. So gut health, I believe everybody know is important. So I am the type of doctor that believe in prevention to prevent diseases. When we prevent diseases, we prevent suffering. I prefer to treat patient at the other end. Instead of treating patient with very bad diseases, I want to treat them before they develop diseases if possible. And then if they have developed diseases, we want to treat them early so that they don't suffer from the disease. So my specialty is in gastroenterology. That means from the top all the way to the bottom, including many organs around it. Okay, can I have the first slide? A very good evening to everybody. So, like I said, the gastrointestinal tract is a very long organ. So it consists of many organs. And also the tract itself starts from the mouth, goes to the esophagus, the stomach, the small intestine, the large intestine. And along it, there are many organs like the pancreas, yizang, the liver, the spleen. All this is also part of the gastrointestinal tract. Next slide. Because of all these organs, a lot of function sometimes can be a problem. And then there are also many diseases can affect all these organs and along the whole entire tract. Because of this, gastrointestinal problem is one of the most common illnesses in our body. I'm sure most of us will experience once in a while some stomach upset, food poisoning, gastric, diarrhea, constipation. Some may have more severe symptoms, some less. But most of us will experience some symptoms along the gastrointestinal tract. Next slide. So basically, why are these gastrointestinal diseases so common? Of course, number one, there are so many organs there. But the other thing, if you look at our lifestyle, next slide. Sometimes when I look at our gastrointestinal tract, it's a bit like this toilet, unfortunately. We keep on putting a lot of things into our gut because we eat all kinds of rubbish. So to me, sometimes it's like this dirty toilet here. We chuck everything down and flush it down, thinking that everything will be good. But sometimes, a lot of times, we are eating the wrong stuff and putting the wrong things or too much of something, and that can lead to many conditions and diseases. Next slide. So look at all these things, especially in Malaysia. We are a nation who likes to eat. I myself like to eat. Too many good food around. But when you have too much of even the best food, can be a problem to our health sometimes. So sometimes we have to be mindful of what we put in and not do like what the toilet shows. We just put everything there and flush it down and thinking that everything will be okay. The other thing is in the next slide. Next slide. Our gastrointestinal tract, the top part, which is the stomach, also have a lot of enzyme and acid. These are important for digestion, and acid is also important to kill bacteria. But sometimes when there is a problem, when there is an imbalance, it can cause diseases, which I will illustrate to you all later on. And then in the gastrointestinal tract, as we know, there are many bacteria and other microorganisms. All these microorganisms, they live together with us. But sometimes when we introduce the wrong microorganism, it can also be a problem to us. Next. And of course, these are the things that comes out. So with all this, the next slide, of course, it can lead to many diseases. So the things that we put in, the things that is already in our gut, and all the processes, the enzymes, the acid, all this can lead to problems. Next. So that's why in our gut, there are many problems from the top all the way to the bottom, midway and along all the organs. So liver, pancreas, stomach, esophagus, intestine, small or large. Next one. So these are some of the diseases. So like in the upper digestive tract, you can have gastric, peptic ulcer disease, reflux, cancer of the stomach, duodenum problem, 十二指肠. Okay, then you can have pancreas inflammation, pancreas cancer, gallstone, liver disease, hepatitis, fatty liver, colon cancer, and the small intestine can malabsorption problem, and organ condition, many conditions that can cause inflammation there, reduce absorption, and all this can lead to many problems. Okay, next slide. This Hippocrates, the great grandfather of medicine, says he believes all diseases will begin in the gut. So if our gut is not healthy, it will lead to many conditions. In a way, it is true because our gut is the gateway. As we know, our intestine, our skin, and most parts of our body is all protected, is covered. So a lot of things cannot enter through our skin. But in the gut is the place where we absorb, and it's also, like I said, the gateway, the entrance of many things, whether it's good things or bad things. If you introduce good things, the good things will go into our body. If you introduce the bad things and bacteria, the bad things and the bacteria or the microorganism can also get into our body. So if we don't jaga this entrance very well, it becomes a problem. Next slide. So for me, I believe if you can heal the gut, you can heal most part of your body. And if you don't take care of your gut, it can lead to many disasters as far as health is concerned. Next. So let's go through the gastrointestinal tract. Of course, due to limitation of time, I cannot talk about the pancreas and the liver and all those. We will stick to just the gastrointestinal tract. At the top, we have food going down to the esophagus and then into the stomach and then going to the duodenum, which is the first part of the small intestine, 十二指肠, okay? So food that goes down must go through the esophagus and in the stomach and get sterilized and partially digested before it is absorbed in the small intestine. So next slide. So to kill bacteria, actually stomach is producing a lot of acid. The acid in the stomach is actually very strong. Okay, the pH can be very low, so low that it can actually burn us. Okay, so the pH can be like 2, 3. So if you remember during our school days, our science lab, if you have that kind of pH and that kind of acid burn onto your skin, it will make a hole there. But the stomach can somehow stand that because it is built, it is designed to actually withstand all this very corrosive acid. Next slide. But sometimes when there is a problem, there is a disease, things will be changed. Our stomach normally has their own defense mechanism. So what happens is the stomach lining, although it's very near the acid, it will produce a lot of defense mechanism. It will produce this mucus lining that acts like a force field. This Mucus lining will prevent the acid to have direct contact onto the stomach. With this mucus lining, the acid can be there, but it will not harm the stomach. There are also many other mechanisms that I will not bother you all. But basically, when there is a problem, for instance, if there is this Helicobacter pylori infection, 螺旋菌, or when you take medication like painkiller, taking alcohol, smoking, and sometimes you have diseases that will reduce the blood flow to the stomach. All this will then disrupt this force field, this mucus lining, this defense mechanism. And that, because of this imbalance, can allow the acid to burn a hole in the stomach, like what you have at the end of the picture on the right. Next slide. So all these are things that can damage our stomach. As you can see, some of these things are not uncommon. You know, bacterial infection, 螺旋菌, quite common. Taking medication, smoking, alcohol. Of course, sometimes it's tumor itself and treatment for cancer. All these also can damage the stomach lining. Next slide. So when there is a damage in the stomach lining, what happens is, it's like you're digging a hole in the stomach lining, stomach wall. So it can become bigger and bigger and eventually cause gastric and ulcer. And this ulcer can bleed, and if it's too deep, can perforate. Next slide. So what happens is, when initially there is just inflammation, and then you get gastric erosion, which is early superficial ulcer, and then deeper ulcer, and then you're bleeding. And finally, if that thing is not treated, it will go through and through the entire lining of the stomach wall and perforate. That means all the stomach content will leak into the other parts of the body, and patient can actually die. Next. So if we are worried about this gastritis or peptic ulcer disease, what are the common symptoms? Usually, most patients will have pain, and then sometimes burning sensation, vomiting, and then if you have bleeding, sometimes you vomit blood, and you may pass motion black stool. So the black stool is like tar, really, really black, okay? Not just dark brown, but really, really black. Sometimes patient may also have poor appetite. So all these can be symptoms of gastritis or peptic ulcer disease. But there are also some patients who does not have any. I've seen patients who do not have any symptoms, no pain at all, and they actually have very big ulcers. So sometimes can be so scary. Things in our gut is very different. The sensation and the way they tell us is very different from other parts of the body. So sometimes things can happen there without any obvious symptoms. Next. So one of the common things is Helicobacter pylori, 幽门螺旋菌, okay? This bacteria is actually quite common and cause a lot of problem. Okay, next. So it is called Helicobacter. So if you cannot remember Helicobacter, just remember helicopters. Okay, so sometimes some patients jokingly they'll tell us, I can't remember something like helicopter. So helicopter bacteria. Okay, so this Helicobacter is actually a very important bacteria as far as gastroenterology is concerned. Next slide. This bacteria was discovered in 1982 by these two scientists, Dr. Marshall and Dr. Warren. With the discovery of this bacteria, it has sort of revolutionized our understanding of peptic ulcer disease. Last time we always think peptic ulcer is because you are very stressed, your bad lifestyle, all this can cause peptic ulcer disease, until they discovered this. And then they found that, wow, actually many patients with peptic ulcer is actually having this bacterial infection. So what's the good news? It means if we can treat this bacteria, we can cure all these patients. So having a causative organism is good in that way. If you know the cause we can treat the bacteria. If you can get rid of the bacteria, we cure the patient. So that's the good news. So after that, a lot of changes in our management of peptic ulcer disease. Next step. Next slide. So this bacteria, like I say, is very common. Depends on where you stay. Some countries, the population prevalence can be more than 50%. That means more than 50% of the population actually have this bacteria. It's one of the most common bacterial infection in the whole world, actually, Helicobacter. And in Malaysia, surprisingly, we are not too bad. Our incidence is quite low. Our incidence is probably about 14% only. This study also in Klang Valley. So this kind of figures is comparable to actually developed countries. So what are the countries or who are the people who will have higher chance of getting this bacteria? It is people who stays in crowded area with poor community hygiene, unclean water. Okay, because we believe this bacteria is transmitted through either oral or fecal oral. That means the bacteria will produce spores, and then if we do not practice good hygiene, that means our hand hygiene, our toilet hygiene, this bacteria can then spread to another person. That's why it's more common in families. So you find that sometimes family members, one person have this, more family members may have that. So usually in our clinical practice, we sometimes will inform the other family members when one is infected, so that the rest of them can also screen for this bacterial infection. Next slide. So when you have this bacteria, what happens is this bacteria is special. Normally, most bacteria, when they are in the stomach, they will be digested by the acid, because the acid is so strong. It can burn a hole in our skin. So, but the bacteria, other bacteria, they will die straight away. Straight away they die because they get digested. But this Helicobacter, they are special because they produce some alkaline around them. So it will protect them from the acid. At the same time, they actually are smart. They actually will actually make holes and crawl into the mucus lining. So they are protected. As I said, this mucus layer is a protective layer in the stomach. So that mucus layer is there. So if those bacteria is in between, so it will be protected from the acid. At the same time, the body's defense mechanism cannot also kill the bacteria, because if the white cell and all those go there, they will also be digested. So they can continue to stay there. But only thing is, these bacteria, when they stay there, they will disrupt the mucus lining, like in the diagram there. And this disruption then expose that area which is infected to the acid and cause the acid to harm the stomach wall. Next slide. So when you have that infection, which is usually chronic, once you're infected, it's not easy to get rid of the bacteria because they are there. So that can cause gastritis, can cause ulcer in the stomach, ulcer in the duodenum, 十二指肠, can also lead to cancer of the stomach, and also this special cancer called mild lymphoma. Next. We believe once you have this infection, everybody will have some gastritis. Some will be more severe than others. The gastritis can affect just one part or also the entire stomach. And most of these bacterial infections are asymptomatic, because the infection has been there for a long time. So our body also get used to it. So many people think that I have no symptoms, so I cannot have H. pylori, I cannot have Loesch-Engin. It's wrong. Many people who are infected are actually asymptomatic. The one with symptoms are a smaller portion, okay? So no symptoms does not mean got no Helicobacter infection. Next slide. So if you're infected, so what? Of course, not everybody will develop problem. But if you are infected, it seems 10 to 15% lifetime risk of developing peptic ulcer disease. Next slide. and your lifetime risk of developing stomach cancer is higher. It's 3 to 6 times compared to another person who do not have this bacterial infection. Next. So now, as we all know, smoking can cause lung cancer. If you look at this World Health Organization, International Agency for Research into Cancer, they classify this as Helicobacter as a class 1 carcinogen, meaning the association between Helicobacter and stomach cancer is as strong as cigarette smoking and lung cancer. That's why it's good for us to actually screen for this and treat Helicobacter, just like we trying to get people to stop smoking to prevent lung cancer. Next. So if you are interested to know who has Helicobacter or Lorschengen, there are many tests you can choose from. There are blood tests, serology tests. You can do urea breath test by just blowing into a bag. And then you can check your stool. And of course, you can also do endoscopy. So each test has its good points and also weaknesses. Like serology is easy to do, but it's not very good in terms of telling us whether the bacteria is still there. The serology will tell us whether you have been exposed to the bacteria or not. So many patients, when they come for blood tests, sometimes many labs actually have this serology test. But serology test, I said, cannot confirm whether you still have the infection. Okay. Urea breath test and endoscopy, and stool test, of course, they are the gold standard. Stool test is good, but then it's very messy, and not many people would like to send their stool, the feces, the shit to the lab. And of course, as people working in the lab also don't like to work with feces, okay? So it's not so popular. So the popular one will be urea breath test and also endoscopy. Endoscopy, apart from diagnosing the bacterial infection, can also see whether the stomach got ulcer, got gastric, got cancer. So you can have many other information apart from telling us whether you have this Helicobacter infection or not. So endoscopy has definitely a good role to play for diagnosing the infection and also looking for its complication. Next slide. So I have mentioned like, wow, this bacterial infection is so bad, so we need to look for it. So after looking for this bacteria, so we also must know how to treat our patients. So what are the treatments? The treatment, is it very troublesome? Actually, the treatment is not. The treatment generally is actually a very simple, short course of antibiotic. So the antibiotic we need is usually 2 antibiotics. And also, we need to suppress the acid because the acid will actually inactivate our antibiotic. So generally, it's always this combination: 1 medicine to suppress the acid and 2 antibiotics generally. And you just give it for about 10 to 14 days. We can get rid of most patients. Usually, the cure rate is about 80%. So if you take the medicine, 80% of the patient will not have the infection. But you need to recheck. If the infection is still there, you are the 20% still infected ones, you just go for a second round. Okay, next slide. So if we can cure and treat the Helicobacter, actually, generally we can cure gastritis, cure peptic ulcer disease. And when we do that, we will reduce people from getting bleeding. Many patients, when they're older, they get peptic ulcer disease, they bleed. They end up in ICU, some die, some will get stomach cancer. So if we actually treat this Helicobacter early in life, you don't have all these things. And then many patients also, when they have Helicobacter, they go to the general practitioner, GP, they get treated for gastric, but then they get the gastric again when they stop medicine because the Helicobacter is still there. So if you really get rid of the Helicobacter, some patient, instead of going to the doctor repeatedly, they will have no more gastric problem after that. So you don't have to spend more money on gastric medicine. You don't have to be on MC. And most importantly, for those who sayang their loved one, you also don't infect and pass the infection to your family members. Okay. And after treating this Helicobacter, generally, the chances of getting back the infection is actually very low. Okay, many patients say, oh, if I treat, then if I eat something outside, will I get it again? So if you can treat it and get it back very easily, then there's no point. Or so sometimes you treat and then you get it, you treat, you get it. But then this bacterial infection is very special. Somehow when you treat it, when you are an adult, the chance of getting it is not very high unless you are surrounded by people who have this infection. So it's a good thing to treat the infection. Okay, next slide. So we hope if we continue to kill this bacteria, eventually one day we'll have very few people with gastric cancer. And actually, we can actually see this change already. More and more people do not get this problem. Gastric cancer is on a decline worldwide because we have been treating patients and we have been screening patients for gastric cancer. So this is one of the things that people like me who like to prevent people from getting diseases do. Okay, so kill Helicobacter and then save the stomach. Okay, next slide. So the other big group of problems that can cause problem in the stomach is this painkillers called non-steroidal anti-inflammatory drug. So a lot of doctors will call it NSAID, NSAID, or steroids and aspirin. These are the common drugs that can cause gastric and ulcer. Okay, next slide. So all these NSAIDs or NSAID are actually pills that can cause problem in the stomach because they will interfere with the production of the mucus lining. Like I said, the mucus lining is so important to protect the stomach. So if you take a medicine that can disturb this mucus lining, just like the Helicobacter, it will then cause gastric. But this kind of medicine are very commonly used, and it's also important because many diseases actually requires treatment with NSAIDs or aspirin. Aspirin, as you all know, is a blood thinner that is used for patients with heart diseases, with stroke. So many people actually will end up having all this antiplatelet. And this antiplatelet, although it's good for the heart and brain, is bad for the stomach. That's why sometimes we gastroenterologists always end up at the receiving end. All the cardiologists, neurologists put them on all this medicine, and then when they have problem like bleeding in the stomach, we have to treat that. So, but unfortunately, it's true. Those medicines are important and life-saving, but it does cause side effect like this. So sometimes we have to think of smart ways to overcome this. Okay, next slide. So we must know who are at risk of developing problem. So generally, those older ones, those with many diseases, those who have history of ulcer, history of bleeding, those who have arthritis, those who have other problems that can affect the stomach, like you also smoke, you also drink a lot of alcohol, those who are taking other medicine that can cause problem in the stomach. All these are people who are at high risk. So all these people who are taking all these painkiller on top of all these risks, we doctors have to be very careful, and we have to educate patients about the symptoms. And also, when we come for follow-up, look for all the signs and symptoms of all this gastric. Next slide. So we also sometimes try to prevent people from getting this kind of problem. So how do we prevent? We use other painkillers which is not in this NSAIDs group. We use lower dose if possible. We choose the NSAIDs which is less ulcerogenic, that means less chances of developing ulcer. And sometimes knowing that this ulcer is because of acid, we actually, if got no choice, put them on medicine to reduce the acid. So on one hand, you can use the NSAIDs. On the other hand is we also reduce the acid so that the NSAIDs will not cause any side effect like ulcer in the future. Okay, by putting them on a protective medicine called proton pump inhibitor, H2 antagonist. These are medicine that will reduce the acid. Next slide. So generally, those two are two common things that can cause ulcer. So generally, when patients have gastric or ulcer, these are the things that we do. We try to reduce the acid. We improve the barrier, the mucus lining. We kill helicobacter if they have. We'll go through the patient's history and see whether they have any other bad habits or things that will aggravate the problem. And then we will then put them on medicine to prevent relapses. We also make sure that patient will change their lifestyle. Okay, next slide. So that is peptic ulcer disease and gastritis. So we move on to another topic called reflux esophagitis, 胃酸倒流. Okay, so esophagitis. So this one is basically acid from the stomach going up to the tube up there, esophagus. So our esophagus is a bit different from the stomach. Stomach has a lot of acid, but the stomach is created to be able to tolerate strong acid, but not the esophagus. Esophagus is not created that way. It doesn't have the mucus lining and all the other defense mechanism. But if the acid goes up there, which can happen when that, you can see that in the stomach at the bottom there, if that area is not closed properly, there's this thing called lower esophageal sphincter. That muscle there is supposed to close that junction. So if the acid goes up through the junction into the esophagus, that can cause damage into the esophagus. Okay, next slide. So acid there can go up if it is overflowing. So sometimes eating too much or overeating can be a problem. Why? I always use this illustration. It's like the basin. When you pour water there, you must let those things go down before you continue putting in more water. Sometimes the problem is we overeat. We continue to overeat until the thing goes to the top part of the stomach and then eventually go up. So all this will encourage the acid to go up and cause further damage. Okay, next slide. So this diagram shows that at the lower part of the esophagus, there's this sphincter that will close it. So if it's not closed properly, acid can go up. So sometimes some people also have this thing called hiatal hernia. Hiatal hernia is a part of the stomach is above the diaphragm, and that can also make reflux easier. And this reflux can cause damage into the lower esophagus. And this damage over the years can cause the lower esophagus to turn into something called Barrett's. As you can see on the right diagram there, Barrett's. This Barrett's eventually can turn into cancer. So if we do endoscopy, we can see whether patient has reflux, hiatal hernia, and also Barrett's, and can take sample to make sure they have not turned into cancer. Okay, next slide. So these are the damages due to the reflux. So it depends on how far the acid goes. If the acid is just at the bottom, lower part of the esophagus, then it will just burn that area, can cause pain, heartburn, and then can cause bleeding, ulcer. And sometimes when the ulcer and all those is so bad, it can cause stricture. Stricture means the esophagus becomes narrow, and then you will have problem eating because things cannot pass through the narrow part. You can cause Barrett's and also cancer of the esophagus. And if the reflux goes all the way up and go in further down into the lungs, it can cause even lung problem. So some patients, they have frequent cough at night. They go to see the lung doctor, the ENT, and then some of them actually end up with us gastroenterologists because their problem is actually reflux. So even lung problem, asthma, sore throat can be due to reflux if the acid goes all the way up here and goes down into the lungs. So reflux can present in many, many ways. So how do we overcome this? Of course, the basic things must be taught to patient. Must remember not to overeat, like I said, like the basin. If you overfill to the brim, of course, it will overflow. It will 倒流. So eating small meals more frequent if necessary. avoid eating and then lying down, because when we are standing up, sitting, our esophagus is up here. So when we are lying down, so stomach and the esophagus same level, so gravity is not helping, so it will just flow across and go into the lungs. Avoid eating 2 to 3 hours before bedtime. Sometimes lifting up the head higher at the end will help in some patients. And then if you are fat or obese, you have to lose weight. Stop smoking. And then there's also food that can cause reflux. Many patients with reflux will know this. When drink coffee, they say, oh, my reflux get worse. Chocolate, oily food, because oily food more difficult to digest. Mint product, of course, water or drinks that can cause more gas, like carbonated drinks, beer, all this can cause more problem. Sometimes fruits like certain fruit like citrus fruits, tomato sauce also can cause, medicine can cause. So what we do is, after doing all this, if patients still have symptoms, we have to give them medicine to reduce the acid, especially for initial phase, so that that area can be healed. And of course, the very bad ones who are not responding to treatment may need to go for surgery, where they will wrap the stomach around the esophagus to make the lower part of the esophagus tighter. Okay, it's called fundoplication. So these are a drastic measure for more serious condition. Okay, next. So that is the upper part of the digestive tract. So in between the upper and the lower, you have the small bowel. Small bowel diseases somehow is less common. Small bowel is important for absorption, for digestion. So usually the problem will be like absorption problem, digestion problem, but things like cancer, all those not so common. So the lower gut is more problematic, because this is the area where they keep all the rubbish, all the dirty things, okay? The tunnel shit, right? So many people ask me, like, why is colon diseases so common? So I usually tell them, you see, the colon is the place where we keep all the feces, all the microorganisms. So if the colon is constantly exposed from the day you are born until now, all this chronic exposure to all this dirty stuff, are we surprised that it will develop cancer, develop inflammation? So of course, it will be the most common area where you develop all these problems, okay? So this area is something that we need to constantly check, monitor, and screen for diseases. Okay. Next. So this is just a picture of the stool, the type of stool. So we are talking, I want to talk about constipation. So our stool, many patients, they don't look at it. But looking at the stool sometimes can tell us a lot, whether it's the color, the texture, how soft or how hard. Like this Bristol stool chart will tell us whether the person is taking enough fibers, whether they have diarrhea, they have constipation, okay? So everybody can see which kind of stool you have, okay? Is it type 3, type 4, or the other type, okay? Okay, next slide. So now I'm going to talk a little bit about constipation. Okay, what is constipation? Constipation means different thing to different people. Okay, some people say infrequent stool is constipation. For some, hard stool is constipation. Some say if I have to strain, I have to use force, is constipation. Some people incomplete emptying, after passing motion, they still feel like want to pass motion. That's constipation. So sometimes for doctors, when patients say, I am constipated, we will have to ask them, what do you mean? What do you mean by your constipation? We need to understand, because different scenario actually is due to different condition. Sometimes certain things can be actually normal. Sorry, 1 minute. 1 minute. 没话. Sorry.
Okay, Dr. Long will come back slightly later on. So we went through the Helicobacter pylori part, and then now we come to constipation. So before that, we also what I think we heard is that actually eating buffet is not so good for our gut health, is it? Because eating buffet actually, actually rise up the gas, the acid level, and then it also find its ways to your esophagus. So eating buffet, it's a thing that I think we need to do it not so frequent, or don't eat too much. Okay, for the sake of your gut health. Okay, welcome back, Dr. Long.
Okay. Okay. The buffet thing, I think eating buffet is okay, but make sure you don't eat like there is no tomorrow, and you must eat until it's worth your money, that kind. So if you eat just because you have many types of things to eat, it's okay, but don't have to eat until you reflux or vomit, until you finish most of the things, until you get your value of your money back, So that is important. Anyway, back to the presentation. Sorry about that. Sorry, hospital calling. So anyway, constipation means different thing to different people. Okay, next slide. So generally for us, constipation can be just change in bowel habit, which leads to more difficult or less frequent of passing in motion. But we must understand, sometimes patients say, how come I only pass motion like every 2 days? Not everybody must pass motion every day. Okay, so passing motion 3 times a day to 3 times a week is considered normal. Okay, so you don't have to be like your spouse or your friend or whatever. Okay, so as long as you do not have pain and your stool is okay, you are healthy. If let's say from younger days you pass motion every 2 days until now it's still 2 days, it's fine. Okay, but if there's a change without any good reason, that one is not fine. Okay, so next slide. Now, just now what I've told you is also important, because we also as a doctor must tell patient what is normal and what is not normal. So not like every time when patient comes to you, I have this issue, then we will investigate them thoroughly like that. So if it's something normal, we'll tell you, actually don't worry, it's something normal. Okay, so generally if you are constipated because of these few reasons. Okay, so basically our stool is the food after being digested goes down to the large intestine. It will be kept there. So our intestine will pump this feces down and pass it out when it's the right time. So we human being can control as an adult. So the feces will then go down to the large intestine, store at the lower part of the large intestine called rectum. So when the time is right, then the lower part, they have a muscle that will guard the exit. This will then relax, and then feces can come out. So for that, all this to happen, you must of course have enough fiber so that the stool will have bulk. If there's no bulk, then of course there's nothing to pump. And can you imagine you want to pump, there's nothing inside there. Or it's too hard because you're dehydrated. Okay, or you don't exercise, because this exercise movement, the pumping movement of the abdominal wall is like pumping the intestine, pushing it down. And sometimes people cannot pass motion because of pain, hospital environment, because they malu, they are not used to the toilet, or they have some neurological diseases. So these are the common cause of constipation. So if you do have real constipation, of course you are first to ask, are you eating the correct things? What are you eating? Enough fibers? Are you taking enough water? So if you are not, that will be the first thing that you need to do. Caffeine can stimulate the gut movement, but it can cause dehydration, because caffeine make you pee more. When you pee more, you can become dehydrated. So sometimes you may want to go through the patient's food diary to see whether the symptoms correlate with the type of food that they take. So we will ask them to avoid certain things that can make things worse. And I will actually ask them to take things that will stimulate them to pass motion more. So you see which one works for you. It can be prune juice. It can be certain fruits like dragon fruit, or papaya. So whichever you like and works for you, you take more of those. Okay, next slide. So next one, we'll talk about gastrointestinal cancer. Of course, cancer is one of those things that can cause a lot of suffering, a lot of pain, a lot of fear. So it will be good if you can address some of this cancer. So today I will focus mostly on the colon cancer. Colon cancer, many people do not know, is actually the second most common cancer. Like I said, why is it so common? Because it's the dirtiest organ in the whole body, the colon, the da chang. Okay, so but somehow it's still below breast cancer. Breast somehow is very common. It's very scary being a woman because of breast cancer, because of hormonal problems. But colon cancer is actually the most common cancer in men because men got very little breast cancer. Men also can get breast cancer, you know. So colon cancer is number 1 for Malaysian men. Colon cancer is number 2 for Malaysian women. Okay. So other GI cancer will be like liver is number 7. Stomach is maybe like 11 or 12. Okay. So we will focus now on colon cancer. Next slide. So colorectal cancer, cancer of the colon or at the lower part of the colon is called rectum. Okay. Colorectal cancer. So like other cancer basically, what is cancer? Cancer is basically our cells, our own cells, after many, many years, transform into something bad. Okay, so this is due to mutation. So mutation, that's why colon, which is the dirtiest organ, exposed to a lot of dirty stuff, toxin, bacteria, is constantly exposed to these things that will sometimes encourage mutation, change our good cell to bad cells. And these good cells to bad cells sometimes may not be easily detected. It's like, because it's just like the other cells initially, until it is bigger and stronger. Then only you find that, oh, actually this one is a bad cell, is a cancer cell. And then this cancer cell will start growing because cancer cell is different from normal cells. Normal cells is, they die after certain time. Cancer cells don't die usually. They can continue to grow. And they grow faster than other cells. That's the problem. And they grow and grow and grow. And once they go into the bloodstream, they will start going to other organs. They will use the bloodstream to move along together with the blood to any other organ. So that's why cancer can spread. We call it metastasis, go to other organs. Okay. And they can also follow the lymphatics. That's why cancer can change from stage 1, 2, and then suddenly become stage 4 when they spread. Okay, next slide. So gastrointestinal cancer is scary because it's inside there and you cannot see until it's quite late. So that's why gastrointestinal cancer, we have to look for them. If you wait for them to be seen outside, you see a lump, it's already very late. So, and the other thing is the organs inside is very different. It is asymptomatic at the beginning. So you don't think that you have no pain, no symptoms, you actually have no cancer. You can actually have cancer. In fact, sometimes some patients got no symptoms, they come for screening and then we check it's stage 4 cancer. Meaning the cancer actually has been there in the body for many, many years without patient knowing. So, and then the symptoms are non-specific. So you may have just bloating stomach or some discomfort. That's all you feel, you know. And this one can be just gastric, can be Loesch-Gene, but it also can be cancer. That's why sometimes patient may have very mild symptoms. It's not wrong or not a bad thing to still check for it, because the mild or non-specific symptom can also still be cancer. That's scary. And then inside, it's a bit different from other organs because there is a lot of space. You know, our tummy so big. So you have a lot of space. So even if there's something growing that big, it can still have a lot of other space for other organs. So you don't feel uncomfortable. Not like our brain. A small thing there, wow, you get very bad headache. You may be paralyzed. But in the gut, the tumor can be that big and still got no symptoms. Because of all this, the disease is usually detected late. So they detect stage 4 cancer, bad news. So this is the problem with all this cancer in the GI tract. Next one. So sometimes to me, that's why I like to really focus more on screening, because we need to actually look for the cancer. We need to be proactive. We cannot say, okay, no symptoms, you look okay, externally you are okay. So for those who are interested, we actually help them to do all this screening, okay? So apart from screening, first patient got to know the symptoms. You may want to do blood tests, stool tests, imaging, check for Helicobacter, and of course, from my side, to consider endoscopy, okay? Next slide. So these are some of the accepted options if you want to do colon cancer screening. You can check the stool. You can do this thing called enema. You can do a scope, the whole colon or half the colon called sigmoidoscopy. You can do CT scan. All these tests has its good points and bad points, but the gold standard is actually colonoscopy. Colonoscopy basically is we introduce a tube, go all the way in and see. If it's there, it's there. So from some of the tests, some of the things like stool tests is good for screening for population. For instance, we want to screen, let's say, 1 million people. Of course, we cannot do colonoscopy for 1 million people. But then it's good to do stool tests to pick up those with high risk. But stool tests sometimes can be positive because you have gum bleeding or you have other things, which is, let's say, piles. So it's not so specific. And stool test is good for looking for cancer. But if you want to look for something before they develop cancer, stool test may not be very good. So colonoscopy is still gold standard. Then some people may ask, how about CT scan? CT scan can check a lot of things. CT scan can check for later cancer, when the cancer has developed a lump. So very early stage, sometimes not easy. And CT scan actually more uncomfortable than colonoscopy because CT scan no sedation. Colonoscopy, we give sedation. So patients sleep during the colonoscopy, wake up already done. CT colonoscopy, we put the tube and then we pump air into the patient. The patient is still awake. So they have to endure this tension, and it's very uncomfortable for patient. And sometimes things that you think is cancer, we see in the CT scan, may turn out to be just shit. Because if we find something in the CT scan, you still need to do a colonoscopy to see whether is there a polyp or a cancer and take sample. So some patients are very disappointed when they know that the thing that they saw in the CT scan is actually just a piece of shit. But they have to do two. They have to do CT scan, colonoscopy, and then colonoscopy, and then cost also 2 times. Okay. So, but it is one of the option. So, we as a doctor have to advise patient wisely and choose wisely lah. But at the end, it's the patient's choice to choose whichever options they want. Okay. Next slide. So this is another slide that shows that is the normal cells turning into cancer. But before they turn into cancer, actually, the normal cells in colon cancer turn into something called adenoma. This adenoma is actually a polyp, okay, like a polyp, just like a small growth. These small polyps can grow bigger and bigger and eventually turn into cancer. As you can see at the lower part of the diagram, the years. Okay, the years shows that actually this thing doesn't happen in a short period. It evolves slowly over many, many years. Meaning that if we can actually do scopes and check for all these patients, we can actually remove all this adenoma to prevent colon cancer. So that is the good thing about colorectal cancer screening, and it's recommended worldwide. And we all believe as a doctor that by doing colonoscopy and removing all this polyp, we can reduce cancer and prevent cancer in many, many patients, especially those with high risk, those with family history of cancer, those with family history of colon cancer, or those with past history of colon cancer. All these people, or those people above 40 or 45 should consider doing this because it's the most common cancer for men, second most common cancer for women. Next slide. So like I said, colon cancer, most of the time they start from this little polyp. And when we do a scope, we can easily remove them by pinching them out or using like over here, this loop called a snare. We can just chop it off with this snare. Okay, we can just cut it like this, or we can connect it to a machine that will burn and seal the thing at the same time. So called a hot snare. Next slide. So this is a scope. Basically, it's a long tube, flexible, and has fiber optic there. We have a camera at the end, and the other end, we have knobs that can control the scope and also introduce instruments to them. So basically, we have technology to see the inside of the gut without cutting patients. So basically, this is a technology that we can utilize. It's just like a long torchlight. We just push it in, of course, quite in, all the way in, and we can see the inside and then pull it out. So like, for instance, the stomach scope is just a 5 to 10 minutes procedure. Colonoscope, if it's done by most senior and experienced doctor, is maybe 15 to 20 minutes. We can see the inside, okay? And we can also take sample, remove polyps, stop bleeding. We can do a lot of things, okay? And it's done under sedation. So most of the patient either don't feel it or will be very drowsy, so they can hardly remember anything. Okay, next slide. So if you're talking about scopes, generally for gastroenterology, got two main scopes. The top scope, which is called gastroscopy, OGDS. Many laymen somehow call it endoscopy, but endoscopy actually means scoping inside of the body, okay? But the right name is actually gastroscopy or OGDS, which is called esophageal gastroduodenoscopy. These are the indication of the scope. If you have upper abdominal pain, you are losing weight, losing appetite without any good reason, you have problems swallowing, food getting stuck, cannot swallow, persistent reflux symptoms, heartburn, chest pain, belching, or if when you do some scans, you find that there is something abnormal there. You have family members with gastrointestinal cancer, or you have a disease that can increase the risk of you getting cancer. All this needs a scope. Okay, next slide. And then for the lower scope, again, is for pain, patient who have diarrhea, patient who have chronic constipation, change of bowel habit. Like I said, sometimes, like I said, 2 times pass motion every 2 days, but then suddenly you pass motion 3 times a day for a long period. Or the other way, pass motion 3 times a day suddenly becomes once in 2 days without any good reason, and it's chronic. You have to check because it can be a cancer blocking the passage. That's why you cannot pass motion. People who are more than certain age, like 40 for me in Malaysia, family history of colon cancer, condition that can increase the risk of one having cancer should also do, losing weight, losing appetite, or you check your feces, got evidence of blood in the stool, patient with pass motion with blood, patient who do not have enough hemoglobin or anemia, pinch. Yes, so it's something also you have to check for this cancer. You have to do a colonoscopy. Okay, next. So basically what I want to highlight and stress is colon cancer is actually very common. And generally it's not diagnosed until it's quite late. Because of the late diagnosis, most patients has poor outcome. So now we have screening and early detection strategy. So one can actually opt to go for this screening. And screening can definitely save life because we can actually detect cancer very early. You must understand cancer. I always say cancer stage 4, bad news. You have to go for operation, you have to go for chemo, radiotherapy, and still few years down the road, many patients will still die. But if your cancer is stage 1, you go for operation, you are cured. You don't need to go for chemotherapy, no radiotherapy. You have no more cancer if you are stage 1. But if I can detect cancer before they can become cancer, that means like in colon cancer, like I said, they come from adenoma. We remove the polyp. Polyps is something that can turn into cancer, but haven't turned into cancer. So if we can detect all these pre-cancerous things and remove them, we can actually prevent people from getting cancer, and that will be 100% survival rate. So you don't even have to go for surgery. Just do a scope only. So all these tests are basically easily available now, and it's generally quite safe if you do it in the proper manner. The risk is very, very low. Okay, next. So this slide is to show that cancer sometimes they just come. Actually, they don't just come, but just that we diagnose late. And we also have constantly hear sometimes our friend and family who are actually quite well. We have seen them like just last month, they were quite well in a party or went somewhere, and then suddenly doctor diagnosed cancer and it's a stage 4. And then within 1 or 2 months, they are dead. So sometimes cancer that are undiagnosed can be so drastic. 1 minute you are there, the next minute you have cancer, and then soon you are not around anymore because it's detected late. Okay, next.
Okay, Dr. Long, due to time constraint, I think we can we go straight to the Q&A session?
Can.
Can, yeah.
So the rest is lifestyle and all those that I've illustrated here
Okay, so we will go to the Q&A session. We have some very interesting questions. Some questions are actually answered by Dr. Long during the presentation. We can get some interesting questions. Why do some people get food poisoning while others remain completely unaffected after eating the same food at the same time?
Okay, challenging question. So, of course, it depends on how much of that food you have eaten, and then whether your personal immune system is strong enough or not, whether you have the antibody to the bacteria. So it's multifactorial. It's not just whether you have eaten the same food. Yeah, sometimes if you're unlucky, you can be the only person in the whole party who ate the same food, who has the diarrhea.
Unfortunately.
So maybe you don't have the immune system to protect yourself to that. Yeah, you can.
Okay. So frequently feeling the urge to defecate but having difficulty passing stool. What methods can help make bowel movements smoother?
Like I said, you analyze what is the cause of your constipation. Is it not enough water, not enough fiber? And then whether you have exercise, whether you're on medicine that can cause constipation. So if you have none, you have to see a doctor. Got to check whether there's some disease that's affecting the gut. And then after that, we will treat accordingly.
Okay. And then the next question is we always hear probiotics. So do probiotics really helps with the gastrointestinal health?
I believe it does help, but not a magic potion. We cannot overclaim. We cannot say, oh, you take probiotic, everything is okay. You have no more constipation. No, not like that. We believe these bacteria, now we learn that they are very important and they can serve a lot of purpose. It can help in many ways. Okay, but we as human beings is very different from animals. In rats, we find that it works very nicely. We can make fat mice become thin mice become fat by changing their bacteria in the gut. But human beings are very complicated. So not so easy, but I think it does help up to a certain extent, like patients with constipation, diarrhea, frequent infection, prevent infection when you travel. All this can help. Antibiotic related diarrhea, all this can help.
Okay. So is intestinal disease caused by insufficient water intake and infrequent bowel movement?
Like I said, water is important. Not enough water, harder stool can cause constipation. So if you have constipation and you feel that you have not been drinking enough, drink more.
Okay, so drink more water. Okay, what tests can be done to understand the cause of frequent flatulence?
Frequent flatulence usually is because of the bacteria in the gut. Okay, so of course it also can be due to the food that you eat. So you can Google food that can cause gas. So you see whether every time when you eat certain food can cause more gas. That will sometimes can give you the answer. But if despite doing all this you are not sure, we will check for bacteria in the gut. We will do scope to see whether inside there got anything or not.
Oh, okay.
And then we will also check whether you have any enzyme deficiency like lactose intolerance. That can cause more gas too.
Okay. Is constant burping also a sign of gastrointestinal issue?
May or may not. Burping is the gas from the stomach going out. So like babies, after babies drink milk, what do? We pat them at the back, get the gas out.
Yes.
So gas comes out is good, because if the gas doesn't come out, then it will be inside, you'll be bloated. Okay. So if there's gas inside, it can also either come out this way or go down the other way. So gas coming out may not be bad, but then if the gas comes out with the acid and cause reflux, cause pain, cause heartburn, that is not good. But of course, if it's too much, then we have to also see why this person has so much gas in the gut. Is it bacterial problem? Is it they swallow a lot of gas? Is it because they drink drinks like beer and all those that produce gas? So all this we have to look into. Again, multiple causes.
So humans are not as simple as mice. We have very complicated. So go see a doctor if you think there's something, okay, to find out what is that. Is stomach disease caused by long-term hunger?
Fasting can sometimes cause problem. Like I said, it depends. So if like many people will ask me things like intermittent fasting, is it good? So some people can benefit from intermittent fasting, whereas others who have gastric problem may not be able to tolerate fasting. So those people who have certain problem and they go do fasting, they can actually develop gastric and ulcer. So sometimes even like fasting month, some Muslim can come for gastric problem because they already have some other issues. So it's okay for some, not okay for others. Of course, fasting too long can cause problem in the gut.
Okay. So not everyone are suitable for fasting.
In a way.
Okay. So is it possible to recover from Helicobacter pylori infection without taking antibiotics?
Not easy. Most will not. Because most of the infection, they are already established when we diagnose them. Of course, if you introduce the bacteria externally, not everybody will straight away get it. But once they are inside there, established, having colonies there, a community there, it's not easy to just disappear, make them disappear.
Okay, understood. So if it's a child that is infected with Helicobacter pylori, could bacteria from an adult saliva be one of the source of the transmission?
Can, but not so easily. But yes, it can be theoretically.
Okay. Can stomach diseases be cured?
Of course. Depends on what.
So it's a very broad topic for this. Okay. Can rectal cancer caused by diet or constipation?
Usually more of rectal cancer causing constipation, not constipation causing rectal cancer.
Okay, so it's the other way. Okay. Do liver disease and pancreatic cancer cause gastrointestinal problems, or do gastrointestinal problems lead to liver and pancreatic diseases?
I think they are related. And then the question is too general. Yeah, they are just part of the gastrointestinal problem. Yeah, they can cause problems to each other. Everything is related.
Okay, everything's related. Having bowel movement every day but needing to go 2-3 times to feel completely empty. What caused this and how can it be improved?
Yep, some people need to go more often than others. Some is psychological. Some people wants to go because they don't want to have so much feces in over there, and every time when they have a bit of feces, they want to pass motion. So that one is common in people with irritable bowel syndrome. Okay, a little bit of feces, they want to pass motion. You don't have to empty everything because the stool is constantly coming down. We are constantly eating, constantly food. Stool will be formed and it will be coming down along the track. So you cannot you can only empty the feces at the end, which is already there. But some on the way there, you cannot empty. So of course, it will constantly you have this. But like I said, most of us, we can actually keep the feces for a longer period until the time is right. So
Okay.
you don't have to like keep on sitting there and empty until there's no more because it will not stop unless you stop eating.
I think there's some misinformation on the internet that says that you need to go toilet for every day for how many times, if not you have problems. So I think there are people afraid of things that happen, so they always wanted to clean everything.
Yeah, doesn't mean that go more is better basically because again our intestine is designed to keep stool. As long as you eat healthily, you don't put not good things into our gut. The gut is designed to keep stool for a day or two. It's fine.
Okay. So what causes frequent bloating? Colonoscopy and endoscopy showed no issues.
Colonoscopy will see in the gut and in the stomach and in the intestine. So it can still be the gas. It can still be things outside like other organs enlarged, too much fat. Some patients say, oh, how come I'm bloated? But you see that they are actually fat. It's not gas. It's not the GI. It's just too fat. Of course, that fat will go away with the scope. So you have to lose weight. Some patients.
So obesity also leads to
yeah, because when your stomach is big, many reasons can be too much gas. Maybe one of the organ is big. There's a tumor there. Too much water, and of course it can also be just fat.
Okay. The next question, I think a lot of people go through this experience is, after drinking coffee, I need to use the bathroom. Eating too much spicy food or chili oil causes diarrhea the next day. I often eat at regular times and extreme hunger leads to stomach pain. So what tests would you recommend to check my gastrointestinal health?
Coffee can stimulate the gut to move. So yes, sometimes we drink coffee, we will want to go. Spicy food cause more sensation. So if you take spicy food, you will be stuck in the toilet longer because the sensation is there and uncomfortable. So you go toilet more often. So it can be a normal thing. But if you're not sure, if let's say last time I can take, now I cannot, why? So sometimes there may be a reason. So of course, if you want to know the reason and get some answer, we have to do some stool tests and also scope to see.
Okay.
And the scope may or may not tell anything positive. Sometimes it may be normal, but normal is still a good result. At least you know there's nothing to be worried. It's maybe just sensitive gut, like I said, irritable bowel syndrome, which is very common.
Okay. So we'll go to one last question. Okay. What are restained stools? What risk do they pose to the body? Is it possible or necessary to eliminate them completely?
I don't really know what they mean by retained stool. A lot of people think that there's this thing called supian and then everything must come out and then the lining also is scraped clean. Like I said, our gut got a lot of bacteria. Most of the bacteria are good bacteria. Not all the bacteria are bad, okay? And some of these bacteria are actually helping us. So you don't have to remove all the thing and clean up the whole thing. So cleaning up the whole thing may not be good. So sometimes I give the example of, let's say, the tropical rainforest. Tropical rainforest, like everything is very messy, right? Chinese like lin like that. But then chop down all the trees and clean up everything and make it barren. Is it good? It's not good for the environment. So when you clean up everything, it's like chopping down all the tree in the forest. So become barren. Then you'll be exposed to all kind of bad things. So I don't believe in all this retained stool and thinking that it's bad. It's just part of it. The stool that is supposed to come out should be able to come out unless you have a disease like your intestine not moving or you have a cancer blocking.
Okay. So we end our Q&A session, and then there's a promotion currently for Life Care. Okay, so the promotion goes like this: OGDS or colonoscopy, or both, with a 1 box or 2 boxes of our life fiber, you get free ECP, HBOT, and LUPA assessment. If you guys want to know more inquiries, or you have any more questions related to gut health, you can kindly contact Raymond. Okay, Raymond, 019-332-7987. You can contact Raymond for any inquiry or about the promotion we're having right now. And then one last thing, we are having a event. We're having an event. It's called the Dong Tok Siu. Okay, 聚餐會. Okay, let me see. Let me show you guys the picture. Questions not answered here. Yeah, because of the time, we're running out of time. So you guys can still ask questions. You guys can contact Raymond. Okay, for appointment, for fiber, and also for questions. Okay, this is also coming events on 2nd of October. It's on a Friday. Okay, we call it a 棟篤笑聚餐會. Okay, 笑着活健康. It's in Chinese. Okay, it's in Chinese. The speaker is Aspirin. So if you guys want to know more about how to health planning, okay, health management, okay, it's a good event to explore more about how to do health planning. So you guys also can contact Raymond, 019-332-7986 for more information. Okay. And then if you guys really have really concerned about your gut health, you can also make appointment with Dr. Long. Can contact Raymond to make appointment with Dr. Long, and you can ask more questions during the appointment. So if you want to make appointment, also contact Raymond, 019-332-7986. All right. So thank you so much. Thank you so much for joining, and see you next time. Bye-bye.